we need to talk about Kerala. A few months ago, it was all the news across the world. Small state in South India beats pandemic. But now there is a big surge in cases. Its case numbers are currently growing at the fastest rate in the country. Kerala has added almost exactly 1 lakh cases so far in September, which is more than all but 6 states. Almost a third of these have come just in the last 5 days. Kerala Health Minister K.K. Shelja blames certain irresponsible behavior for the rise in cases. The opposition has been holding protests and said that the state would be left with no option but to go in for another round of complete lockdown if people did not cooperate. Hi, my name is Pallavi Prasad, and though we all wish it, the pandemic is still very much raging. Fatigue is not an option, and our newsworthy COVID-19 bulletin is just what you need to keep up. Across the country, the judiciary too is sensing this fatigue in the people and the government and is having to intervene. The Madras High Court asked the government to strictly implement punishments for not wearing a mask and spitting in public. The Karnataka High Court has dismissed the report of the state-level COVID-19 committee, which said that the state is more than ready to deal with the pandemic. The court has asked the government to change the constitution of the committee because cases are only rising in Karnataka, especially in Bangalore, and this committee just won't do, the court said. The Madhya Pradesh High Court was the most direct. It has asked the government to make sure that no gatherings take place in contravention of rules set by the central government, and if it can't do that, then the court will be forced to do something. It was referring to political rallies in the state for the upcoming by-polls. Specifically, the court said, "Be you ever so high, the law is above you." This sense of caution the judiciary seems to be displaying for now is exactly what we need. India's numbers are on the verge of getting better. That is, if trends continue the way they are right now for a few more weeks, we can say that the pandemic has slowed down. Last week was the second straight week of decline in new cases, and the sharpest yet. It has also been over 3 weeks when more than 90,000 cases were detected in a single day for the first time. Usually, daily detections see a big surge after every 2 weeks, since that's the average time people take to begin showing symptoms. There were also fewer deaths last week compared to the previous one. The Institute of Mathematical Sciences, Chennai, says that the R value, that is how many people does one COVID-19 patient infect, has reduced in 5 high burden states: Maharashtra, Karnataka, Tamil Nadu, Andhra Pradesh, and Uttar Pradesh. But again, patience and caution are key here. We have to see if these trends hold, but that doesn't seem to be the case. The UGC has directed all colleges and universities to begin classes for the next academic year from 1st of November for first-year undergraduate and postgraduate students. They have to finish all admission processes by October end. And in the Supreme Court, the UPSC said that the civil services exams cannot be postponed because of COVID. The life-changing exams for lakhs of people must take place on October 4th. What conducting these exams will do to our current hopeful trends, time will tell. Vaccine-wise, Adar Poonawalla, the man leading Serum Institute of India, which is where the bulk of any COVID-19 vaccine will get made if and when the time comes, he is having a hard time making up his mind. A few days ago, he said that he's set to test and manufacture the vaccine, but the state doesn't seem to have a distribution plan. Will the government of India have 80,000 crores available over the next 1 year? He tweeted. Because that's what the health ministry needs to buy and distribute the vaccine to everyone in India. But yesterday, after Prime Minister Narendra Modi told the UN that as the largest vaccine producing country of the world, India will do everything possible to further global good, Poonawalla said that it is clear that all Modi's arrangements for India will take care of all needs for the Indian people. So what gives? Globally, the virus has killed over 980,000 people. The global death toll is fast approaching the 1 million mark. When the WHO was asked if 2 million COVID-19 deaths were unthinkable, it said that 2 million or much higher is quite likely before a vaccine is ready if we do not take concerted actions to control the viral spread. Not just test and trace, not just clinical care, not just social distancing, not just hygiene, not just masks, not just vaccines. Do it all, it said. That's me for today. Thanks for listening in.